Hello and welcome to Long Beach Lens. I'm your host, Derek J. Simpson, Executive Director of the Long Beach Community Action Partnership. In 2018, I was invited by our National Community Action Partnership Office to attend an invitation-only conference with the U.S. Surgeon General for 2 days discussing the vital conditions for health and well-being. The conference was hosted by the Wellbeing Legacy in Oakland, and it was a very inspirational experience to hear from colleagues in various levels of community service, politics, and health around the nation. Long Beach Community Action Partnership created 3 panel discussions to share thoughts and insight based on 2 very important reports, the State of Black Long Beach and the African American Community at a Crossroads. On one particular panel, we hear from our own Long Beach leaders in the public and private sector about health strategies in our community. The level of leadership could not be any higher in Long Beach for this discussion, and the depth of insight no more enlightening than what you will hear in the time allowed. Note that terms such as well care are used, and strategies are discussed that take on a more holistic approach to the needs that families present. One thing that we often take for granted is disaster preparedness. Having lived through several Category 5 hurricanes in Mobile, Alabama, and earthquakes here in California, I know what it is like to be without the basic necessities of food, water, and shelter that we take for granted. After this segment, I would think that it would be in public health and our families' best interest to take away some thoughts that help us be better prepared.
I'm Anissa Davis. I'm the City Health Officer for the City of Long Beach. I represent the Long Beach Department of Health and Human Services. And we really are the organization who is responsible for the public health for all of the residents of Long Beach. So public health really is having a safe and healthy place to work, live, and play. And that's what we represent.
Good afternoon. I am Carolyn Caldwell. I'm the president and CEO of St. Mary Medical Center here in Long Beach. And Derek, thank you for hosting us. And I'm so excited to be on this stage with these women today and with their various background and leaders, because I think it just shows to me what public health is really all about, is how we all work together for the betterment of our community, because none of us can do it alone. From the hospital standpoint, people often think about is sick care. People come to us when they're sick, but one thing we're really trying to focus on is well care. How do we partner with our community partners to reach people before they ever become sick?
Hello, my name is Jennifer Ponce. Thanks again for inviting us all here. And I am the Chief Health Education Officer at the Children's Clinic in Long Beach. And although we're called the Children's Clinic, we see adults. In fact, about a little under 50% of our patients are adults. And public health for me is a chance for everybody to have a healthy life, mentally, physically, socially, emotionally, and to tap in, to work together and tap into the community's intrinsic wisdom. Thank you.
All right, and my name is Diane Brown, and thanks for having us. I am with the City of Long Beach's Department of Disaster Preparedness and Emergency Communications. I'm also I teach public health at Long Beach City College, and I worked for the Long Beach Health Department and LA County Public Health departments for many years. So although disaster preparedness and emergency communications may not seem like it is a public health issue, our goal is to help make communities more resilient, which is exactly what public health is all about. So I'll be able to provide that perspective as the panel continues.
Let's stay with you for a moment, Diane, because when you talk about that resiliency, and I know you were at one point wearing a different hat and working in the community, and specifically in the African American community as well. What was the perspective on resiliency that you experienced personally as you were working to help the community at various levels?
African Americans are disproportionately impacted by disasters, and so recovery, it's one thing to get through the disaster, which might be a day, which might be a week, but communities see those impacts for many months to years after the disaster has passed. And so helping communities to be resilient, to be able to recover as quickly as possible from those disasters is vital to making communities thrive and for them to be healthy. So there is definitely a connection between public health. When people are impacted by disasters, they are out of their routines. If we're looking at individuals who are elderly or who are disabled or who need medications, a disaster is going to make it more difficult for them to live healthy lives.
Dr. Davis, I know in Long Beach, I once heard a presentation that talked about the differences in life expectancy from one zip code to another. Very profound. Can you share that information and your perspective there, please?
I sure can. So there's between a 7 to a 15-year difference in life expectancy in Long Beach among different neighborhoods. So depending on where you live in Long Beach can determine how long and how well you're expected to live. And really the contributing factors are the things that we've been talking about throughout this day. So it's unequal education, unequal jobs, unequal access to jobs, unequal housing opportunities, public safety issues are all contributing factors to why there's such a great disparity within the city. And it's really a public health major concern that we're fighting at the health department.
Ms. Caldwell, I know you're somewhat new, relatively speaking, to our community, but you are in charge of one of the major hospitals here, and I know that you and your team see the faces of this community in a very distressful way each day, and you work hard to alleviate those concerns and bring them back to a healthy status in life, whether it be in that emergency room or bringing new birth to the community. But what are the stories that you're seeing personally and through the eyes and ears of your team there at St. Mary's, especially as it relates to the African American community?
Yes, Derek, and thank you. You know, it's really difficult to talk about health care or public health without talking about social determinants of health. And what are social determinants of health? It's your social determinants of health determines your health outcomes. It's where we live, it's where we work, it's where we play. And unfortunately, in a lot of the African American communities, access to health care, living in unsafe communities, those are all things that impact their health care. Mental health is another big challenge that we face. And so in hospitals, I always like to say, we typically will receive all of the community's ills or all of the issues that are happening in different communities. And so what we try to do through a lot of our outreach efforts, we have our mobile unit, we have our clinics, we have individuals that go out, we do free vaccinations. So we really try to meet people where they are. I've been doing this for a very long time, and I've always been a community advocate, wherever I've lived and worked. But the one thing that I've found that's so important is that still till this day in the African American community, there's not a lot of trust of the healthcare system. And that's really sad. And so that is why we take it upon ourselves to go out into the community. And it's also important why we need to make sure as leaders in our healthcare institutions that we have leadership teams, we have boards, physicians, and employees that are diverse. Because when people come into the system, they feel a lot more comfortable when they see people that look like them.
What we're seeing is a lot of concern about being able to pay rent, being able to buy food, running out of food before the end of the month. So we really can't talk to patients about a healthy diet if they're concerned about where they're going to live. So we have a trauma-informed approach that is a healing approach, and we really try to work with patients and partner with them. It's a partnership. And if we can't help with rent, but we can help sign families up for food stamps. We have food pantries at our clinics. We can help them with the discount programs with the phone, to have a phone or utilities or things like that. So we really try to help them in the other things. We have several community classes where we don't even talk about health. We just say, come and cook. We're going to all learn how to make something today, or we're going to sew something together. So it's just to get folks out of the house so they're not socially isolated, and to begin to feel a sense of community, little by little.
Diane, I want to go back to emergency preparedness, because as we are recording this, it's raining outside, right? And the rain outside may be minute in my hometown of Mobile, Alabama, but for here, it could be a disaster in terms of people who aren't prepared. So for those who are watching and may underestimate what it means to be prepared, what would be some of those things that you would say to this audience that you may think you have it, but if you don't have 5 gallons of water, for instance, or a gallon of water for each day, that you may be out of touch, you're in trouble, or if you live in a high rise, et cetera. Give us some insight on that.
Sure. Well, in the West Coast, California, we are definitely not as prepared as our friends and family in the Midwest and on the East Coast, because they deal with these weather issues every day. In Long Beach, I think we have, 250, 300 sunny days a year, and so it's hard for us to think about a major disaster happening with our reality, but anything can happen. I mean, thousands of people just went through a disaster. It wasn't a national disaster, but 35 days of a government being shut down, for those individuals, that's a disaster that can change their lives. And so thinking about those things that we would need to survive on our own for days and days is what we really mean by preparedness.
One of the things that is particularly affecting Long Beach is sexually transmitted diseases and HIV. And unfortunately, African Americans are overburdened with both of those diseases. Gonorrhea, chlamydia, syphilis, and HIV are the major reportable STDs. And Long Beach is number 2 in the state for rates of gonorrhea and chlamydia, and number 3 for syphilis. Wow. And all of those rates are higher in the African American community. And congenital syphilis, which had almost gone away until about 10 years ago, kind of started a resurgence. Long Beach hadn't seen any in several years, so this is when you pass it down to your baby. Mm-hmm. We've had 8 cases in 2018. It's a completely preventable disease if you get treated. 7 of those 8 cases were among African American women, and it kind of points to the social determinants that Carol was speaking about, because a lot of times, most of these women are homeless. There's usually a mental health issue. There's poor access to health care. Sometimes there's other children that she has, and she's worried that if she goes to a doctor, that she'll be reported to Child Protective Services, either because of drugs. There's a lot of transactional sex, either for somewhere to live or for money. So I just wanted to bring that up, right. that is something that is really affecting the city of Long Beach, and we're doing all sorts of things out in the community. We're up in North Long Beach and Central Long Beach to address that.
Carolyn, are there any particular trends that you're noticing there at St. Mary's, be it from the African American community or otherwise, in terms of health issues that you're seeing maybe a spike in or consistency with?
Definitely some of the sexually transmitted diseases. And one thing I I have noticed, particularly in the African American community, is stigma around certain, diseases or conditions. We have CARE, which is our care program at our facility, and it's been around since the 80s. So we take care of individuals who are impacted or infected with HIV and AIDS. And what we find, and I think Long Beach has a very high prevalence of individuals living in the community, but unfortunately, oftentimes in the African American community, because of that stigma, they may test positive, but then getting them to get into care sometimes is very difficult because they're ashamed, or my family think, and because we as a society have created this stigma. The same thing with mental health. I just had a friend this week that said, I think I've got some issues here. I'm finally owning up to it. I'm going to get help. And this is someone who's African American male. And he kind of made a plea that, as a community, we really need to stop with some of the stigmas around some of the illnesses that we're impacted by, because it's really killing us. And so that's what we're seeing.
I know that the Children's Clinic is actually in school sites. And I would imagine that dynamic of actually being in the school is offering you quite a bit of insight that you wouldn't ordinarily get even before you get to the hospital. You're seeing it at the Genesis often, right?
Right. It is beneficial to be at the school sites. We're in a middle school and a few elementary schools, and it's nice that we can build rapport and a relationship with families, and that they begin to feel comfortable with disclosing anything they need to disclose. And if they're not ready to disclose, that's fine. Our message is, we are here when you need us. We'll always be here, and we'll do whatever we can. But it's important that people feel comfortable and not feel that maybe they're being judged or anything like that. So yeah, the school site really helps us do that.
Knowledge is power, and what a powerful panel of women making profound change in our community. We are very fortunate to have their passion and leadership focused on public and family health for our behalf. This panel's discussion, as well as the other panel discussions in this series, can be seen in its entirety at patnet.tv, video on demand, and on Patnet's YouTube channel. With perspectives on health in mind, let's listen to a bit more insight on the concerns for public health.
I think right now the greatest public health issue affecting our city is lack of affordable housing. That has an impact on homelessness. We see a lot of individuals who are experiencing homelessness right now, and there are a lot of people that are experiencing homelessness that we don't see because they may be couch surfing or they're just hidden. It also, lack of affordable housing also means that people don't have resources that they can contribute to other things like healthy food or medical health insurance or medical supplies and medicines. So affordable housing, I think, could really be beneficial and has a public health impact.
There have been some issues with some of the homeless encampments where I think that the District 9 homeless shelter and permanent residents will do a great service. So I am a person that walks the streets and lives in the community. I work in the community, and I really believe it's getting better, but there's still things that need to be done.
I think there is an awareness and a consciousness of some of the issues that we're facing, and I think there are people that want to find solutions, and so it's just finding innovations figuring out ways to work with our community to find solutions that are going to work.
I've seen changes since I work for the City of Long Beach Health Department. We do have issues that are not necessarily being addressed in all of our communities. I see efforts being made by our city to increase our patrols and the civic engagement of the police with the community. I don't believe that it's done, but I believe that it's better.
What is the greatest public health issue facing our city?
Violence. Violence outside of oneself and the violence that is happening within our community to ourselves. Back in the 90s, many of us in public health tried to get violence recognized as a public health issue. I think violence with drug abuse is violence to the self, and I do believe that in public health we have a responsibility to those that cannot care for themselves or those who are addicted. I work part-time at a local clinic in addiction medicine, and I see so many people who are doing violence to themselves who need help. So I believe defining violence both as individually and as a community, it's right now a public health issue for me. However, I've worked with the police in this community, and we have seen there are good policemen and there are some that need to improve. We have a health department that works in conjunction with the local civic leaders, but I don't think there ever can be enough alliances, things in conjunction with each other, and education about what it means to be safe, what it means to have opportunities, and also to have a spiritual center, a place to go to when you know that you're in an unsafe place. So many people just don't know the resources, they don't have the access to this, so that's what we do. In public health, I'm a public health professional for over 30 years, and even community organizing is public health to me. Housing, jobs, everything that relates to a better outcome for a human being.
As community members, we need to work with our educational leaders, with businesses, and with our policymakers to find solutions that are going to work for our city. Public health impacts a lot of different areas. It impacts how students learn. It impacts our economic agencies, and so collaborating and finding solutions together is going to be beneficial for our city.
Be in support of our public health department, which is a wonderful staff. Those of us that are retired from there, we still stay involved with things like elder abuse and other important issues. And to keep the public health department funded, it's 98% funded through outside sources, but it does need the city to help with additional grants. And so I think that keeping the public health department at the forefront of the City of Long Beach with the city, other departments, is essential. And I salute the leadership that started there with, on my term, Deanna Bonta, through Ron Arias, and now to Kelly Colopy, who is our Director of Public Health.
Lack of affordable housing, its impact on public health, and homelessness are perspectives some don't consider, and yet are most important. We also heard thoughts regarding violence as a public health issue to oneself and the community. In essence, public health eventually becomes a very private matter that impacts all elements of our city and personal quality of life. It is important for us to all be aware of how we fit as individuals into the mosaic of contributors to public health strategies that make our city a better place to live and work. It can be an overwhelming experience when we consider all the vital conditions of health that were covered on this panel and alluded to on others. Lifelong learning, meaningful work, and wealth, humane housing, reliable transportation that gets you home and to work safely, a healthy environment with clean air, water, food, and other choices. All of these elements add up to a better quality of life if addressed, and community distress if not. Thanks to our leadership for making positive change. I encourage you to get civically engaged to ensure we all continue to be accountable. Thank you for joining us today's show. Be sure to follow PatNet TV on Facebook, Twitter, and Instagram for the latest updates. We also welcome your comments and thoughts regarding this show as we strive to make Long Beach Lens a favorite source of local news, information, and entertainment. This show has been brought to you with support from the Long Beach Community Action Partnership. Thank you for watching Long Beach Lens.